So we have Dayleen here with us today. Thank you so much for joining us today. It's nice to meet you.
Nice to meet you. Thanks for having me.
Of course. And can you please state your full name and the current organization that you work for?
Yes, Dayleen Rodriguez, and I am with Metro Health Hospital.
Oh, wonderful. What area of Metro Health do you work for?
So right now I'm a community health worker in the family medicine at the Ohio City office.
Wonderful. Oh, I love hearing that. I love Metro Health. So anyway, thank you so much for being here with us today. And I hope you've been enjoying CHW Day so far and all the activities and everything. So I would love to just start some questions with you just to learn a little bit more about your experience as a CHW. So a lot of the CHWs we've talked to today all sort of have a common thread of lived experience that really motivated them to get into the field of this work. So can you share what your why is?
Yeah, so growing up, I was raised by a single mom who did not speak English. So as a child of a parent who doesn't speak English, you're pretty much the adult very young. And that came with learning to maneuver, learning the community, learning the benefits, learning what to do to help out, to, help my mom out. And that came with me going into a role of interpreting. And I actually am a medical interpreter, certified medical interpreter. And I did that for a few years at Metro Health. But I found that with being an interpreter, I was just a voice in the room. And there was so much more need that I could see, and I could not help. So I felt like I needed to go into a role where I could help. Not only I could be the voice and advocate for the patients, but I could be that person that can bring the resources to them. So for me, understanding, why I do this is understanding why not. Understanding that if I don't do it, if there isn't someone like me out here that's going to help and advocate and that's going to bring the resources, a lot of people are going to go without. So understanding the importance of what my role is.
Wow. And that's amazing because we know CHWs already fill so many gaps, but it sounds like you fill even more of a niche gap that is there that really needs to be filled. Right. So the work you're doing is incredible. And so has your why changed at all from when you got into the community health worker space compared to now?
I think it has, not in a negative way, but more, again, understanding. Because when you're boots on the ground, when you're there, when you're seeing the need, it motivates you to do more, to learn more, to network more, to get to know different people so that you can bring other resources that perhaps you weren't aware of. So it pushes you to learn more about your own community and what's out there so that you can help them.
And along the way, have you encountered any kind of barriers in the ways that you're able to facilitate the care that you're trying to provide?
Many barriers. So many, there's not enough. There's never enough. And you try to, again, like I said, get to know what's out there, the organizations that network, but, sometimes it's just not enough. And we see so many people right now that are homeless. That, shelter is one thing that is so difficult here in the city of Cleveland. And, when you have a family in front of you who needs a place to stay and you can't even get them into a shelter sometimes because there's a waiting list. So that's very difficult. That's a very difficult barrier to navigate.
And how are you able to manage those kinds of barriers? I mean, obviously when you have lived experience, so your heart's a little bit heavy when it comes to these things. Right. We tend to be in the helping field because we're helpers and we feel more deeply. So when you encounter those kinds of barriers, how are you able to manage that?
I have to do a lot of prayer and understanding that as much as we can't take this home with us, right? We want to,
Absolutely.
But, it's so difficult. So understanding and separating the two, but definitely lots of prayer and lots of meditating and, and just asking God to just help, in those areas that we can't help, to open the doors in those areas that we can't open the door. And He always provides.
Absolutely. Well, thank you so much for joining us today, Dayleen. You really are doing amazing work, and thank you for sharing your impact with us. And we appreciate everything that you're doing. And I really hope you have a great rest of the day here at Community Health Worker Day.
Thank you so much.
Thank you. So nice to meet you.
Likewise. Thanks.
Thanks.